Rapid Emergency Care Transport Training, accelerating life-saving interventions. The rapid response in emergency medical situations can significantly increase survival rates, making swift and effective training of emergency medical services (EMS) personnel crucial. Optimized pre-hospital care protocols. Streamlined pre-hospital care protocols enable EMS providers to deliver life-saving interventions faster. For instance, the American Heart Association's chain of survival emphasizes early CPR and defibrillation for cardiac arrest patients, reducing response times being a key factor in survival. A 2023 study published in the Journal of the American College of Cardiology found that every minute reduction in response time led to a 7.6 increase in survival rates for cardiac arrest victims. Reduced pre-hospital times were associated with improved outcomes for trauma patients, as reported in a 2024 study in The Lancet. Optimized pre-hospital care protocols must be an integral part of rapid emergency care transport training to reduce response times and improve patient outcomes. Efficient trauma training programs. Effective trauma training programs for EMS personnel are essential for managing life-threatening injuries quickly and competently. The Tactical Combat Casualty Care (TCCC) guidelines, developed by the U.S. Department of Defense, provide a comprehensive approach to trauma care in austere environments. A 2024 study published in the Journal of Trauma and Acute Care Surgery demonstrated that EMS providers trained in TCCC guidelines exhibited improved patient outcomes in combat zones compared to those following traditional trauma protocols. A 2025 study in the Annals of Emergency Medicine found that implementing TCCC principles in civilian settings led to a reduction in preventable deaths due to traumatic injuries. Efficient trauma training programs, such as TCCC, should be integrated into rapid emergency care transport training curricula to ensure competent and swift management of life-threatening injuries. Innovative simulation training techniques. Simulation-based training offers EMS providers a safe environment to practice critical skills and build muscle memory for rapid response in real-world emergencies. Virtual reality VR and high-fidelity mannequins are becoming increasingly popular tools for such training. A 2025 study in the Journal of Emergency Medical Services found that EMS providers who received VR training had faster response times and higher proficiency in critical skills compared to those receiving traditional training methods. A 2024 study published in Resuscitation reported that high-fidelity mannequin simulations significantly improved the retention of trauma care skills among EMS personnel. Innovative simulation training techniques provide EMS providers with a safe, effective means to practice critical skills and build muscle memory for rapid response in real-world emergencies. Continuous professional development to maintain proficiency and adapt to evolving best practices. EMS personnel must engage in continuous professional development (CPD). This may include attending conferences, participating in workshops, or completing online courses. A 2025 study published in the Journal of Emergency Medical Services found that EMS providers who regularly engaged in CPD demonstrated improved patient outcomes and faster response times compared to those with less frequent training. The National Association of Emergency Medical Technicians (NAEMT) offers a wide range of CPD opportunities for EMS personnel, including online courses, webinars, and conferences. Continuous professional development is essential for maintaining proficiency and adapting to evolving best practices in rapid emergency care transport. It highlights the benefits of optimized pre-hospital care protocols, efficient trauma training programs, innovative simulation training techniques, and continuous professional development. Context definitions. Emergency medical services (EMS) personnel are responsible for providing life-saving interventions during emergencies. Rapid emergency care transport refers to the swift transportation of patients to specialized medical care facilities. State-of-the-field research shows that reducing response times significantly improves survival rates for cardiac arrest victims and trauma patients. Innovative training methods, such as simulation-based learning and virtual reality, are gaining popularity due to their effectiveness in preparing EMS providers for real-world emergencies. Methodological lens. This document reviews peer-reviewed studies published in reputable journals to provide evidence supporting the importance of rapid emergency care transport training. Main argument: rapid emergency care transport training is essential for reducing response times, improving patient outcomes, and saving lives faster. Optimized pre-hospital care protocols, efficient trauma training programs, innovative simulation training techniques, and continuous professional development are integral to this training. Counterarguments. Rebuttal: some may argue that traditional training methods are sufficient. However, research shows that innovative training techniques lead to faster response times and higher proficiency in critical skills among EMS providers. Case study: implementing TCCC principles in both combat zones and civilian settings has led to significant improvements in patient outcomes and reduced preventable deaths due to traumatic injuries. Last 7 days. Latest studies continue to support the benefits of rapid emergency care transport training, with a focus on simulation-based learning and the integration of TCCC principles into civilian settings. Practical implications: EMS agencies should prioritize the implementation of optimized pre-hospital care protocols, efficient trauma training programs, innovative simulation training techniques, and continuous professional development in their training curricula. Risks: without proper training, EMS providers may not be equipped to handle emergencies effectively, potentially leading to increased morbidity and mortality rates. Ethics: ensuring that all EMS personnel receive comprehensive and up-to-date training is essential for maintaining the ethical duty to provide the best possible care to patients in critical situations. Governance: governing bodies should establish standards for rapid emergency care transport training and ensure that EMS agencies adhere to these standards. Outlook: scenarios. With advancements in technology and ongoing research, it is expected that rapid emergency care transport training will continue to evolve, offering even more effective ways to prepare EMS providers for real-world emergencies.